Hi, I'm Dr. J. Varma, and welcome to Thermometer. Today, we're talking about infant botulism, a rare but dangerous illness that's back in the headlines because of a nationwide recall of powdered infant formula. Parents are understandably worried, so here's some important information that you need to know. First of all, what is infant botulism and how does it happen? Infant botulism is caused by a bacteria called Clostridium botulinum. This is a naturally occurring bacteria that's found in the soil and in dust. But this bacteria can produce a toxin, one of the most potent toxins known to man, and the same one that's used in Botox injections that are used to treat wrinkles. There are two types of botulism that babies can get. The first is called foodborne botulism, and that's when a baby eats food that already contains the toxin. Think about dented cans, for example. The second form of botulism is known as infant botulism, and that's when a baby eats formula or honey that contains the spores of the bacteria. And then those spores grow inside the gut of the baby and release the potent toxin inside the baby's bloodstream. So, what are the symptoms and when do you need to worry? Well, symptoms can start anywhere from 12 to 36 hours after eating contaminated formula or honey. Some of the first signs may be very nonspecific and subtle, like constipation, a weak cry, and poor feeding. But as the toxin spreads through the body, the baby can develop floppy arms and legs, droopy eyelids, and trouble breathing. This is because the toxin is blocking the ability of the nerves to get the muscles moving. So the baby is essentially becoming paralyzed. So if your baby shows these symptoms, it's important that you seek medical care immediately. Now, how is infant botulism treated? Well, the first and most important thing is get to a healthcare facility immediately. Babies with infant botulism are hospitalized because they need supportive care to help them with breathing and support to help them with feeding, potentially even having food delivered to them intravenously. They are then treated with a special antitoxin known as BabyBIG. This is an antitoxin produced from human derived what's called botulism immune globulin that when given intravenously can help your baby to recover. Well, how do you protect your baby from getting this disease in the first place? Well, one of the most important things to keep in mind is that honey is not something that you should be feeding any child under the age of 12 months. And that's because honey can contain these spores that, when they're introduced into the baby's gut, can produce the toxin. And second, if there's an outbreak going on, check the FDA and CDC websites. Make sure the formula that you're feeding your baby is not on that recall list.